Good morning, everyone. My name is Seema Gajwani. I work at the Public Welfare Foundation here in Washington, D.C., and I'm the Program Officer for Criminal Justice. The Public Welfare Foundation is a nationally focused foundation based in D.C., and we are a privately funded philanthropy working to advance justice and economic opportunity for all. I oversee the criminal justice program, as I mentioned, and our goal in the program is to reduce America's growing incarceration rate that we've seen over the last 30 years. And over the last several years, we've been focused specifically on the very front end of the criminal justice system, on America's jails, and on the decision-making point of pretrial detention policy. And we've been focused there for the last 3 or 4 years because of the sheer volume of people who come through America's jails, and also because of the harmful effect of jail detention on those people. When you look at populations, and most of the criminal justice activity and reform work over the last several years and decades, it's been focused on jails. It's been focused on prisons, and prisons house, on any given day, about 1.3 million people. Jails, however, across America, see 11 million folks cycling through every year. So jails are where our communities are touching the criminal justice system. That is where most people are harmed by the criminal justice system. Now, mind you, 90% of the people who are cycling through our jails are not going to go on to prison. And that's because most of them are low-level offenders committing low-level offenses. However, they are sitting in jail for some period of time, mostly short periods of time, 2, 3, 5 days. Many sit there for weeks, and many sit there for months. But people are going through our jails in vast numbers. The research is now showing us, though, that those people who sit in jail, even for short periods of time, are oftentimes harmed by our jails. They're harmed individually, and also they're harming our communities. Research shows that if you were to take 2 individuals who are arrested and come through our jail system, at the point of pretrial detention, what happens is a judge or a magistrate or some judicial officer has to make a decision whether that person will sit in jail pending their trial or adjudication, or whether they'll be released to the community to come back to court for their next court date. If you take 2 people who are similarly situated, same charged offense, same criminal history, same risk level, what you'll find is that the person who is detained pending trial, compared to the person who is released to come back to court, will be more likely to get a worse plea offer, more likely to be convicted, will be more likely to get an incarcerative sentence as opposed to probation, and then a longer sentence. And what recent research has shown us is that even low-risk folks staying in jail for short periods of time, 2 to 3 days, are more likely to have higher recidivism rates 2 years later. Why is that? Because a person who is low risk, who is detained, the thing that makes them low risk typically are things like their ties to the community, their employment, their responsibility to take care of children and other family members, and even short periods of stay in a jail are hugely disruptive to the things that make them low risk. And what we also know is that if you put a low-risk person with a high-risk person locked up, the low-risk person will become higher risk and not the other way around. So not only are we harming the individual who comes and sits in jail, who will likely not go to prison anyway, but we're also harming the community that that person goes out to ultimately. If you overlay on top of these statistics and this research the fact that we have high rates of mental health issues, substance abuse disorders, disproportionately high to the general population of those who are sitting in jails every day, you see that the connection to our criminal justice system of these folks is detrimental to everyone. Before I was a program officer at the Public Welfare Foundation, I was a public defender here in Washington, D.C. for 7 years. And many days a week, I would spend my mornings in arraignment court, in the basement of Superior Court in downtown D.C. And what we would see day in and day out was that there would be folks who were arrested who were coming through before a judge and they were clearly struggling with mental health issues or substance abuse disorders. And it was plain as day to everyone in the room. The judge knew it, the prosecutor knew it, the defense attorney, everyone in the audience. This person was crazy, or they were strung out. And we knew that when they went back out into the community, untreated, they were going to continue the same behavior that got them wrapped up in the criminal justice system and in that courtroom as they had done before. But we all also knew that there was no way that you could connect those folks to care in any reasonable amount of time at that point in the system. There were week-long waits at the decent mental health provider available at the time. The substance abuse providers often had lots of criteria that excluded many people. The care was substandard in many places, and there were waits for the good places as well. There was no way you could quickly connect somebody to care. And by virtue of that, that made those people risky. And in the eyes of a judge, they almost had no choice but to lock up those folks, regardless of their level of risk. It was a pipe dream at the time that those folks en masse could be covered, could be connected to care, could be treated for the things that were underlying their criminal behavior. And now, it's not so much of a pipe dream. It's a possibility, and it's a possibility because of the Affordable Care Act. It's a possibility because of people in this room, and it's a possibility because of folks like Steve Rosenberg and his team at COCHS, because of the Langeloth Foundation and the Robert Wood Johnson Foundation. So thank you to all of you, and thank you for the chance to realize that vision on behalf of the Public Welfare Foundation.